Hey, what up all my tooth doctors and doctresses? Welcome to another video at the Tooth Factory. Our video today is based on a small discussion topic of the relationship that the coronavirus shares with the oral cavity. Is it cause and effect? Is there a relationship? Or is there just an association? Well, here we go. Point number one. The oral cavity, along with the nasal cavity, is the entry gateway to the coronavirus. Well, how does it enter our system? How does it end up in the lungs? Well, in our oral cavity, we have tongue, gums, salivary glands, the salivary system. All of them, they have cells with a specific receptor that coronavirus latches onto and enters the cell and starts replicating itself. What is that? It's called the angiotensin converting enzyme 2 receptor. Why is that point important? Well, in a debilitating health condition, which means if a person's immune system is weak, in that case, the angiotensin converting enzyme 2 increases in number. And that allows more susceptibility for the coronavirus to latch onto it, get into the cell, replicate, and give us an infection. Well, why does a person have debilitating or weakened condition? Primary reason is a debilitated oral health condition. So, our oral health is just as important as the rest of the body, if not more. Which means if you have more plaque in your oral cavity, if you have more cavities in your oral cavity, if you're not following good oral hygiene instructions and routines for maintaining the cleanliness, then you are more susceptible to letting the coronavirus enter your system. Point number two, we are all aware of the links between the periodontal diseases in the gums that can be so severe that they can make their way in form of bacterial infections into the heart and lead to a specific disease called infective endocarditis, correct? Well, the same goes with the lungs. See, coronavirus enters our cells. They make our system really, really weak. Along with that, if we have a plaque-inducing, a gingival health debilitating condition in the oral cavity where you have inflamed gums and you have plaque and tartar everywhere and you have lots of cavities, well, you are inviting more and more bacteria that will take the oropharynx route into the throat, into the upper respiratory tract, down into the lungs, and cause a lung infection of bacterial origin along with the virus itself. So not only are you letting the coronavirus attack you, but you're giving it friends in the form of bacteria that'll give you upper respiratory tract infections. It'll give you lower respiratory tract infections. It'll give you lung infections, maybe fill your lungs with fluid and help the bacteria kill you. We did speak about how coronavirus can enter through our oral cavity as a gateway and then affect the later on sets of the systems. But what about the actual oral cavity, physically the tissues of the oral cavity? How does the coronavirus affect that? Well, that's where point number 3 comes into place, xerostomia. Most of us know xerostomia as a condition in which salivary glands do not produce as much saliva, making our mouth turn dry. It is also a side effect of many drugs that are used in antibacterial origins or antivirals as well. So, xerostomia can occur due to 2 main reasons. One, there is a potential theory that the coronavirus itself infects the salivary glands, forcing it to produce less saliva. And the second point is when you do contract the virus or virus-like symptoms, you take treatment. And that treatment can directly cause suppression of the saliva. Well, xerostomia is one of the indicators of coronavirus infection and its severity. Point number 4, it's the oral mucosa. You know, in a little background, the oral mucosa, the inner lining of the cheeks, the palate, the floor of the mouth, the tongue, all of that has been considered as a primary indicator of any systemic condition that runs through your body. And therefore, it can also be used to indicate the severity of coronavirus. The coronavirus causes our immunity to deplete, and that depletion of our immunity is responded by the oral mucosa and the inside of the oral cavity in forms of ulcers. They can be burning, they can be red, white, dull, painful, and they can go away in 1 to 2 weeks. But they are an important indicator to take care of the oral cavity now. Point number 5. Did you know that the American Dental Association has ran a survey on people being treated for coronavirus, and they found that 59% of the people had increased in grinding their teeth, bruxism, and that's clenching of the teeth, due to anxiety from contracting the virus or anxiety from family members contracting the virus. And 53% of those people have more incident rates, which means newer people have had cracked tooth or chipped teeth. And majority of them are the people in the care of ventilators, in the care of extreme medical attention. So cracked teeth and chipped teeth can also be found in coronavirus and its effects. And the last point number 6, is called COVID tongue. There's been a lot of discussion on whether COVID tongue is real or not. Well, in my opinion, COVID tongue may not be real, but tongue condition due to COVID is real. What I mean by that is initially at the beginning of the video we mentioned that there is an enzyme, a protein called angiotensin converting enzyme 2 that is located in all cells of the oral cavity, correct? Well, the tongue has a lot of ACE2 enzymes, and coronavirus loves their receptors, which means the concentration of the coronavirus in the tongue region, in the muscular region of the tongue, is very high. And that can be locally responsive as bumps or rashes on the tongue or loss of taste or swelling of the tongue, and that's what they like to call the COVID tongue. All of these signs may just be a secondary association with the coronavirus. They may not be related, they may not even be a direct causative agent. But the fact of the matter is that the importance of keeping the oral cavity hygienic, keeping it clean, is at utmost of importance, and we need to understand that, and we need to let our family members, our friends, know its importance. The coronavirus's gateway is our oral cavity, and all we have to do is lock those doors, and it's very simple to do so. By maybe brushing twice a day, putting in some flossing effort, using mouthwash, gargling after you eat something sticky. All of these little habits on a regular basis will keep you less susceptible to contracting the virus and keep you from developing severe effects that can lead to a lot of pain. And this also goes out to the people who have unfortunately contracted the virus and are currently on treatment. Everybody in that category needs to take care of their oral cavity more importantly than non-contracted people. It will really help you over time fight the virus and its effects. So everybody, please, from the Tooth Factory, we request everybody to go ahead and speak to your family members and your friends and tell them that the oral health care is at top of the significance in preventing the severity of the coronavirus. And that is something so simple to take charge of and control of. Begin your day with brushing and end your day with brushing. It will really help. So here's Tooth Factory signing off. Stay healthy, stay safe, and our prayers are with the people fighting coronavirus.